Involuntary passage of urine while sneezing or coughing or laughing is a common problem, and this video is all about the causes and treatment of this problem. I am Dr. Shobhana Mohandas. I work as a consultant gynecologist and laparoscopic surgeon at Sun Medical. Stress incontinence of urine comes because of lack of support to the middle portion of the urethra through which urine passes. This support is necessary for holding the urine when you cough or sneeze or laugh. When the support is gone, obviously the urine will leak out. So how to prevent it? Easiest thing is to support all the muscles with strengthening it. That can be done with Kegel exercises where you tighten your pelvic muscles without tightening any other muscles around 20 times in the day and evening. To the count of 10, you tighten it. To the count of 5, you release it, and you continue this forever. This can tighten the muscles, but many people do not follow it strictly, and it's difficult for us to think of it all the time, and generally patients don't do it properly. The second thing is, when you travel, what you can do is not drink a lot of water, look after your sneezing very correctly. Of course, you can't say don't laugh, but at least take proper medications to control your sneeze. And the next easiest thing is to use a vaginal tampon. That will support the mid urethra and it will prevent the leak. Or these days, menstrual cups are very common in India. Inserting a menstrual cup will also straighten the mid urethra and you can prevent a leak. The only thing you have to remember is they are not permanent methods, because if you use a menstrual cup or a tampon throughout the year, throughout the month, it's going to cause infections. That is going to be a problem for you. So it's only temporary. What next? The next would be use of drugs which can tighten the muscles, but these drugs can cause drowsiness or tiredness, and sometimes it's not effective in some patients. Some patients are happy with it after 15 days, they say they are okay. But if it doesn't work, you have to go beyond that. Another remedy is the use of high-fem chairs. These chairs use electromagnetic waves which will stimulate the pelvic muscles and give 11,000 times more effect than the Kegel exercise, and it will strengthen the muscles below the urethra, and the patients get relief by half an hour sessions every twice a week for 6 sessions. Almost 80 to 90% effect is there, and it's found very effective. These high-fem chairs are also useful for urgency incontinence. That means you want to pass urine, and by the time you reach the toilet, you wet your underclothes, and you need to carry special pads or panty liners, and this is called urgency incontinence. That also is treated by high-fem chairs. Beyond this, there is laser treatment, but that requires undressing of the patient. In high-fem, you don't need to undress. In laser treatment, laser is inserted inside the vagina and it stimulates the connective tissue as against the muscles and strengthens it. There is also electromagnetic vaginal therapy where the muscles are strengthened inside the vagina. So that these are the methods which are non-invasive. In very severe cases where the patient can't even sit, even just moving around makes a leak, these are the cases which are candidates for surgery. Surgery can be done under local, but generally we do under general anesthesia. A tape is passed under the urethra, and this tape is taken out from the thighs, just the groin near the thighs, and it pulls the urethra up, the mid portion. Therefore, this angulation is maintained forever. It's generally very good, and around 90-98% success rate is there. Once in a while, patients do come after 1 year or 10 years or something like that, saying it has recurred. So everything has got small side effects, but by and large, all these methods are useful for correcting urinary leak. I hope you have a leak-free period in your life. Thank you so much.